Good evening. My name is Jonathan Landsman. I'm our board chair. This is our regular general board meeting for the month. This is February. So, right? I just want to make sure I'm checking. Yep, February 21st. There we go. So I'm going to bring us to order. First item on the agenda is a roll call vote. Let's see if I have that right. I don't have the agenda in front of me. Call the meeting, Pledge of Allegiance. All right, so we'll stand for that. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Next, we'll do a roll call.
Mr. Young.
Here.
Mr. Furman.
Present.
Ms. Namie Dyer. She did give notification. Mr. Cowan.
Present.
Mr. Torres.
Here.
Dr. Hans.
Here.
Ms. Newman. Ms. Root. Ms. May. Here. Ms. Woodruff.
Here.
Dr. Giles. Mr. Landsman.
Here. So we have a quorum. Next, we need, next is public comment, or is this approval of the agenda? Okay. So next, I'm looking for a motion and a second in support for tonight's agenda.
So moved.
Thank you, John. Who was second? Who was support? Adam. Thank you, Adam. So we have motion. We have a second. Any discussion? All of those in favor say aye.
Aye.
Any opposed? Motion carries. Next up is our public comment. It's first of two. If there's anyone who wishes to make public comment, I see Fred in the audience. Do we have anyone online?
Nothing online.
Okay. So, Mr. Cummins, it's the floor is yours. As you know, we welcome public comment. Everyone has a 5-minute window to speak.
Got it. All right, I passed this out. You have it before you. This is more recent version than what I gave you some weeks ago. And actually, I presented this to the Board of Commissioners last week to encourage them to advocate for change. And I hope you will take a look through the whole thing. But I want to draw your attention to a couple in particular. It's number 11 and number 14. These are revisions which will particularly discourage the interest of insurance companies in a potential profit, because they make profit from what they don't do, not what they're required to do. So, first one, number 11, calls for independent oversight and accountability. This is focused on the top levels down, not the bottom level up. And this says accountability in particular of the legislature and the administration to meet what's needed by communities across the state, as opposed to just look at what they have to budget and not necessarily attention to what the need is. The goal is that this organization will look at what the need is. They'll have administrative and legal authority to make sure that the system is doing what it should be doing, and that the legislature and the administration are really aware of what the needs are. Insurance companies won't like that. They don't want to be aware of what the need is. And I'm talking about the real need, not just the ones that knock on the door or bang it down, not just crises. And if you were paying attention, the bill that was submitted last session by Mary Whiteford had an oversight provision in it, but it had no teeth in it. It was just, you get a committee together and you talk about what's good and what's not bad. No investigative authority, no legal authority to do anything. This says we're actually going to do something. and it has to be independent, so it's not driven by politics. The second one is eliminate what we call managed care. I call it budget-driven care. Basically, the primary focus of our care is, does it fit in the budget? It doesn't really allow for professional discretion. We have professionals to make professional judgments of what people need. That's not what we pay attention to. It's what can we afford? That's the wrong answer. So, again, the purpose of the accountability organization is to make sure that everybody understands what the need is, generally, and that the budget covers it. So the budget is not what controls. What should be controlling is professional judgment. And what the need is not just who's dangerous. The need is who has a need and could be in trouble at some point, but not when they go into crisis. Don't wait till they go into crisis, get the problem solved up front. In particular, that goes to children, which nobody's been paying a whole lot of attention to at all the last few years. After the COVID, we got a little more attention. But that's a real problem. And it has to be early intervention. Probably 100,000 people across the state don't have any services because there's no intervention. Nobody cares. So again, we have to let professionals be professionals. Use professional judgment to say what's needed and provide it. That's fundamental. It's also a reason we don't have that many professionals who want to work here, because they're not allowed to be professionals, particularly psychiatrists. So think about that. Providing good care is more than just checking off boxes and going down the list and see if, do they need this, do they need this. It's very personal. It's human care. It's caring about people and making sure that you are giving them what they need, not just what it says on a list. So I encourage you to go through the whole thing, but think about those things that will keep the insurance companies away from the door next time. Thank you.
Thank you. We appreciate your comments and keep them coming. Thank you. All right, is there anyone else that would like to make public comment? Hearing none, we'll move to the next item on the agenda, which is my favorite part of our meetings, which is Stories That Inspire Hope. And tonight we have that with the Auburn Hills Police Department Chief Ryan Gagnon and Officer Marlissa Miller of Bloomfield Township. Cool. Thank you.
Good evening. Thank you for having us. I'm Tricia Zizumbo. I'm the Director of Training and Justice Initiatives with OCHN. I'm really excited to have our law enforcement and co-responder here with us. So I'd like to introduce Chief Ryan Gagnon from Auburn Hills Police Department, Marissa Miller from Bloomfield Township Police Department, and then our own co-responder, Hillary Nussbaum, and they are going to share some stories about our co-responder program and the benefits they are seeing from that program.
Thank you, Tricia. Mr. Chair, members of the board, thank you for the opportunity to come tonight and share a little bit of the good work that we are doing in partnership with OCHN that we're very proud of. I know you know a little bit about the program, but we launched in September of 2021 through a grant, thankfully, through the Community Foundation of Southeast Michigan. Prior to all of that, for about 12 months, we did quite a bit of research looking at co-responder programs around the country. What are some successful programs? What are some areas that need some improvement? And what we identified is it's imperative that we partner with community mental health in the community that the individual that's co-responding with us is an employee of OCHN, so that they have the pipeline to the resources that are needed for people. So we are proud to partner with OCHN, and we're very thankful and grateful for that partnership. In fact, this has grown to now 4 communities: the City of Auburn Hills, Bloomfield Township, City of Birmingham, and now the City of Rochester. It's got the attention of U.S. Representative Haley Stevens, who fortunately with the work of Francis Carley here from OCHN, helped us and assisted us in writing a grant and getting awarded a grant for $260,000 to hire a second mental health clinician and bring on the City of Rochester. So briefly, in a nutshell, we're very thankful for Hillary because it's extremely important that we hired the right person to fit within law enforcement and mental health services, and Hillary's been a blessing. This is a change for law enforcement in our response to people in crisis, and it was important that we did that. And having Hillary on board, really, at this point in time, we have officers on scene trying to assist people in crisis, and they're calling on the radio, "Where are you at, Hillary? How long is it going to be till you get here?" Because she can provide that professional service and the resources that people really need. So to date, we've served about 780 people in the 4 communities, and I know, talking to Tricia, I know there's a few other partner communities like Troy and the Oakland County Sheriff's Office of nearly over 1,100 people served. But some positive things that we've experienced that really hit home for some of us, and I'll be brief with this, but the impact we didn't see. The primary focus was serving people in the community, but really there's been a lot of positive service provided to even staff and first responders within the agencies that we didn't expect, quite honestly. But when it comes to people in the community, I think of a 14-year-old young man that backed a U-Haul truck into his dad while he was at an apartment complex. And unfortunately and tragically, the father's leg was severed and he passed away at the scene. And this 14-year-old young man who was there in total shock and grieving from witnessing this trauma of a tragic accident that killed his father right in front of him, Hillary was there within minutes, working shoulder to shoulder with us, consoling the young man, and eventually continuing to follow up with his family to ensure that he got the proper help he needed. And that's one example that I was a witness to that was really impactful. The stories go on, and the reality is that when people are in crisis, there's certainly a level of anxiety, and particularly with police responding. But on the other side, there's anxiety from us too, from the police officers responding. These are very dynamic situations, a lot of emotions involved, and it can be scary for first responders as well. And so having Hillary there in a professional manner that's calm, that's not wearing a police uniform, really brings down and de-escalates things so that we can get to the root cause of what help does this person need. And ultimately what we're seeing is, and the goal of this program is to reduce the amount of times that law enforcement needs to intervene and be called to scenes, but also, I think in the grand scheme of things, it reduces hospitalizations, because before all this, all we knew is whether or not somebody reached a threshold of do they need to go to the hospital or not. And now there's times where Hillary's like, no, this person doesn't need to go to the hospital. They're connected to resources. They're in the system already where we can provide help. All I need to make a call, or they have family resources available. So ultimately, it reduces hospitalizations and calls for service, and we're very, very proud of the partnership and extremely grateful for OCHN and all the work that Hillary does, and looking forward to bringing on a second clinician in the future. So thank you.
Hello, my name is Officer Miller, Bloomfield Township Police, and for 14 years I was a patrol officer. And for those 14 years, I wished we had a co-responder responding out to the scenes. There was many times where we would encounter people in a crisis, and we simply just didn't know how to talk to them. In law enforcement, it's hurry up, let's get to the next call. So that's where the crisis intervention training has come very, very helpful. It has taught us officers to slow down, help empathize with these people that we find who are in crisis, and take that extra minute or two to help calm them down at best, and help get them to where they need. And then when we hired on with Hillary, there was so many families that I could think of who could have benefited from her on the times that I was on the road. This family, because there was a lot of situations where, like the chief said, it was either hospitalization or there were some where we knew they needed help, but we just didn't know where to turn or where to look. And now our co-responder helps answer that question. For the last 2 years, I've been working in the schools, and now in a post-Oxford era, I can tell you our co-responder has helped immensely with threat assessments and help keeping our schools safe. I've leaned on her heavily to help come and help interview some children, help answer that question, do you think they're capable of school violence? And if they're not, let's get them the resources that they need. If they are, there's issues in home. So having a co-responder, I think the only thing that, for us at Bloomfield Township, we wish she was there full-time, because there's that much of a need. Mental health doesn't know race, gender, money, jobs. It doesn't understand any of that, and we see it so many times. I've seen it in a fifth grader I had to do a threat assessment on, and on a 17-year-old case that I'm working on right now, all mental health related. And I just wish there was more of Hillary to go around. So it's such beneficial.
Well, thank you. I'll make sure I pay you guys tomorrow for these comments, and this was very kind. Thank you very much. It's honestly been a privilege and an honor for me to be able to work in my 4 departments that I'm at. Every day I go to work, I'm really actually excited because I don't know what the day is going to have in store, and usually it's always something great. I go to work and I work with really great people and partners, and it's just wonderful. So as Chief Gagnon was saying earlier, I've had some really unique experiences being able to do this, and just a couple kind of quick stories that I know off the top of my head. Actually, one of our other co-responders, Ken, who's in Troy, he and I were actually riding together. This was part of his training, and there was an accidental death that occurred in the township, and we happened to be very close and were able to go. And the death of it, he was a construction worker, and it was a construction accident, and there was other construction workers on scene who witnessed, unfortunately, his death. And Ken and I were able to go and respond together, and that was, for me, really the true idea of what a co-responder is we were able to kind of triage those individuals on scene and sort of deal with them sort of, as they needed it, and help them. So that was a really unfortunate experience, but also a great experience for us as co-responders to be able to go and serve and help in that way. And Trish reminded me of this too. One of the things that we went through is a CISM training, critical incident and stress management training, and Birmingham Police Department had a pretty difficult suicide that they experienced on scene and had to go and respond to that. And I was able to go and provide a debriefing for the officers who did respond to that scene. And my initial thought going into this was, this is going to be really interesting because a lot of the officers on scene are seasoned. They've been doing this for 20 plus years, and I'm not sure how they're going to respond to this, and talking about this critical incident. And the two administrations, the sergeant and the lieutenant on scene, were the ones talking the most and sharing their thoughts and their feelings and the things that they had experienced and what was difficult for them, which allowed then some of the younger officers to feel open to share as well. So it's been, like I said, such an honor to be able to experience that and walk through some of these incidents, not only with officers, but with people that we serve, and just be able to be in the community and help in any way that I can. So it's, I love the job. I'm happy to be here and be a part of this community. So thank you.
There's probably a lot of stories from all of our departments including the 4 that we talked about this evening, but also Troy, also Pontiac. And so it's hard for us to kind of narrow it down, but wanted to be able to use our stories that inspire hope, whereas we may not have an individual that was served by this program, but where we can share the impact that it's having on our law enforcement partners and ultimately our community. So we are working as an agency and then with our partners to expand, but if you have any questions on co-responder or CIT, we'd be happy to answer any of them.
Okay.
I don't have a question, just a comment. It's so exciting to hear police officers talking the way that you are talking tonight. I almost want to say hallelujah, like we were in church.
Just don't start singing again.
Oh, I won't. But I'm very, very grateful for the program and the opportunity for us to serve, and just hopefully more funds will come through so we can do more of this, because it's amazing. Thank you so much.
Jennifer?
What, I guess, what are your hours? Like, it's non-traditional, I'm assuming, right?
Yeah, I'm laughing because that's the question that I get a lot, and it varies so much,
Right.
that it's hard to answer. Typically, I try to run like afternoon hours, like a 12 to 10 p.m. type of schedule. That's where we found that a lot of calls occur the most. Before I started this job, each department sort of took a bunch of data to kind of show when the most calls come in, and that was the time where these calls come in the most, is between the 12 to 10 p.m. hours. That can vary depending on meetings or, other things kind of going on. It just depends. But I try to typically respond in those afternoon, evening hours.
And then you're in the 4 communities then?
Correct, yeah.
And then I know the city of Rochester is coming on board through a grant, so then that would be an additional person, correct?
That's correct. They're the 4th community, and when that money was approved, it's been I guess in every industry, a challenge to hire people. And in this one is so important to find the right person, and I think we have. But we're in the process of bringing on that second clinician.
Okay, all right. And, and I hope you guys are doing stuff to take care of yourselves, because just hearing the stories and the things that you endure, obviously, you want to make sure that you're okay.
Yeah, I appreciate that. I actually have a really good team around me, and if I do go to any kind of critical incident, Tricia and Siri both know about it, and I have my own therapist, so that helps to kind of keep me in check. So I'm making sure that I'm keeping myself healthy as well.
And I applaud this work. I work in probation, and I started 20 years ago, and I remember the first judge that I worked for, lock them up, stick them in prison, kind of mentality. And then right around the 2005, 2006, we started these specialty courts. You got mental health courts, drug courts, you have family drug courts, veterans courts, all these kinds of things. And it's really this approach of how can we help people, right? People who are enduring mental health issues, drug addiction, all these kinds of things, because we know a lot more now than we knew before. So when I see these kinds of programs and when we hear about this as a board, my ears always perk up, because it's exciting that these innovations are coming. We're seeing it, we've been seeing it in the courts for the past decade. It's really grown, and, seeing it in policing is awesome. So thank you all for what you're doing, and you can tell that you're all passionate about it and you really believe in what's happening. So I appreciate that.
Thank you.
Yeah, I just wanted to point out real quick, and didn't want to lose the opportunity to say this, but there's a couple things that really have changed since we instituted this program. Is Hillary does a lot of follow-up with families. I mean, I can tell you that I have family members that utilize services, and I have a passion for this. But there was a time when we had no idea how to navigate the mental health system, and so Hillary is that conduit to meet with families. Many times at the onset of this is during adolescence, right? And parents have no idea what to do or what's going on. Hillary can offer that assistance, which we've never done before. She can also look at calls for service, repetitive addresses or people in an aggregate, put things together and be like, this person needs mental health treatment because we're going down a path of destruction, and next thing you know, a tragic incident's gonna happen, or police are gonna have to intervene again. And why are we waiting? Why are we waiting to be called, for 911 to be called? So she proactively can go to the probate court, get a petition for hospitalization, which we never did before. We don't do that, we're just reactive. So it's hard to measure all this, like the outcomes, but that's really been beneficial to families, I think, in the community.
I think we can add to is, the 4 communities, Chief Canyon and them, we're working closely with Wayne State, so we are doing some research. And as soon as we have that data and those outcomes, would love to bring Wayne State back to present to our board to really look at the outcomes, that they are kind of going in, and I think that would be great, for all of us to see.
Another thing I want to add too, before I forget about this, because I wanted to say it earlier, thank you. With CIT training, or the Crisis Intervention Team training, I have a really unique perspective because I get to see a lot of officers that get to go back and actually implement CIT, and I can tell you that in each department I can pick out officers that are truly passionate about CIT, Officer Miller being one of them, who really take it to heart and use it out on the road. And so it's really exciting for me to get to see that and watch them kind of begin to use those skills and take it to people that we serve. So that's been a great experience to watch.
Actually, if you wait one,
Oh, yeah.
2 more speakers, so Bajaya.
Well, I want to thank all of you for the work that you do because I have personally experienced this. My son, who has developmental disability with quite severe behavior challenges in the past, he lives in Rochester. Mom and dad live in Bloomfield Township, and he works in Auburn Hills. One of the incidents that happened about a year ago was that there was a change in his staffing that he was not prepared for. Nobody told him that he will have different people working with him. So he had a meltdown one day, and it happened because he was out in the community and he is used to working with only one person. That day, somehow, there were 4 people in the car. This was a change for him, and he started to have a meltdown. They pulled into a gas station, and this new person, the person who was with him, did not know what to do because they had not gone through the crisis plan or anything. And the thing they did was call 911, and the officers were the ones who de-escalated the situation. And instead of ending up in the ER in handcuffs or restraints or whatever, he was taken home where he calmed down and he was fine by the evening. And your point that most of these incidents occur in the afternoon is because that is the time for the transition from a structured environment into an unstructured environment, and even that can trigger a meltdown. So thank you for your service, and I can vouch for all 4 communities that they are doing a wonderful job. But we need to expand this because this can happen anywhere. Thank you.
Thank you, Vijaya. John?
I just want to add my thank you to everyone for your service, and also you kind of mentioned the communities, and since the university sits at the intersection of all those, we are making progress to join. When it came up in 21, we were in challenging times with COVID, to say the least. So we're looking at expanding that. I know Chief Gordon has spoken with Dan, so hopefully that'll happen soon.
Christina?
Thank you. Sorry, I'm just jumping out of my seat because I love this. We're so happy to have you. I'm a social worker, and in high school I wanted to be a police officer, believe it or not. So I love this. Thank you so much for sharing everything. And yeah, I think this is going to be a movement, right? And we already have gotten some national attention, so as much data as we can keep collecting and sharing these outcomes that's what's going to bring in more money, and whatever we can do to keep applying for grants to expand this and put more Hillarys in communities, I 100% support. So I was just curious, Hillary, are you an LMSW?
Yes.
Okay.
Yep.
Awesome.
Wayne State is my alma mater too.
Me
so,
too.
yeah.
Yay! And I had an idea. So you mentioned how Hillary, how you follow up with families, right? That takes a lot of time. In social work, it's important, but it takes a lot of time. Have we thought about interns, having interns who can help in these departments?
I'm gonna let Tricia take that one.
We're exploring a lot of different
Yeah.
options. Chief Gagnon mentioned all the models that we've looked at. We continue to look at models. Siri Secor is our manager of justice, and there's been some new different conferences and trainings specifically on co-response that we're looking into.
Okay.
But I don't think anything's off the table. We've talked interns, we've talked peers.
Right.
As we look to expand and but how we do keep that clinical fidelity as well is very important to our staff and to the program.
Sure.
But definitely, I think Hillary would love help follow up.
Yeah.
There.
Yes, yeah. So maybe we can talk to some of our universities
There.
and see. I know I would have loved an internship like that. But thank you for all that you all do.
Dennis?
Yeah, when we were told this program, was in early stages, Genesis, and I knew this was going to be something that was going to be helpful. I come from a family of first responders, primarily police officers, and I just knew that this was going to be helpful. But what the stories you told go way beyond what I could have even envisioned. And I can see Officer Miller from, you're on the streets, and the story you told about the school threats and the assessment help you get. And Chief, it's clear that leadership's so important, and you're obvious to that. I mean, you're passionate about it, and I know that drills down to all the men and women that work with you. And Hillary, you're a trailblazer. There's no question about it. And this isn't a story that inspires hope. This has got to inspire action. I wish I could package you all up, take you in front of the county commission, and tell them, if you aren't listening, there's something wrong with you. But we're gonna. I hope you might have to do this again. You might have to be called to testify somewhere. This isn't testimony, but no, this is just great. And thank you very much. And I guarantee you, we're gonna make sure that with what you've done, the groundwork you've laid, we're gonna build on it. That's a trailblazer.
And Dennis, I will let you know, we have been meeting with our commissioners for a few months, developing some project plans and sustainability plans on how we expand co-responder to the entire community, to the entire county.
Well, if you need any help with them, I know a lot of them.
I can tell you from a local government perspective, on behalf of all 4 communities, our elected officials are like, no matter what the cost, we're continuous. I mean, it's been outstanding support from all the elected officials as well, so.
Sarah?
So, there's an unintended side effect, or maybe just overlooked, that I'm really excited about. My husband's a first responder, and I've actually been I've been speaking with him, but the chair of their union has also been talking about it, how first responders often witness horrible things, and it's kind of just built into either their personality or he works in Hamtramck. It's a very tight-knit, fraternity type. And, they just shove it down and keep moving. It's what you have to do because you have to keep working. But I think it's great that because Hillarys are so involved in these departments that when a first responder does need help, they know that they have someone safe that they can reach out to and just be sent to resources. And I think that's really helpful because, often at home, first responders, especially when they're, working 24-hour shifts, they have home pressure, and they try to split it and protect their family from what they've experienced out at work. And so they don't often reach out for help, even from their loved ones. So I think that this is really exciting.
Yeah, thank you. I'm not gonna beat around the bush. There's certainly I've been a police officer for 24 years. There's certainly been a stigma associated with mental health in public in general that we're trying to eliminate, but in law enforcement even more so, because if you speak out, people are worried about their careers and their jobs, right? And over the last few years, law enforcement in general across the country, there's been a major push for self-care of first responders. I think over the last 4 years, more officers have taken their own life than have been killed in line of duty, and that's a serious, serious problem. So when it comes to leadership and these agencies, it's a big concern that we have, that we are providing resources to first responders. It's a big push, but it's still a culture where it's like, suck it up, let's go, we're on the next call, or a bravado thing, that we need to eliminate. So there's a lot of work going towards that, which is very, very positive, but it's certainly always a challenge, and we want to encourage officers to open up, speak up, raise their hand if they need help, and there's zero consequences if you do that. And to have these partnerships are just a resource, not just Hillary, but the resources that OCHN can provide in general for people is huge for us. So thank you.
Other board members with questions or comments? Before we let you go, I have a couple of questions as well. You mentioned earlier, Chief, that this is based off a grant. When does that expire? What can be done about renewing that grant? Because typically there's it's a one and done kind of thing on grants. And what additional services are you all looking for where we might be able to help?
The grant is a 12-month grant. However, there's an opportunity to go beyond that, maybe up to 18 months. It was part of the federal physical budget for 2023. There's been a challenge in hiring, so that might give justification to expend the money. It includes a big portion for CIT training as well. So, but it's kind of like a flash in the pan. It was through SAMHSA, but it was weird. It was earmarked through the Federal Appropriations Committee, and coming out of COVID, there was a lot of money. The reality is the grant processes, from my experience with it, or what OCH told me, it wasn't the same. Like it was just kind of like, get the money out, but we're always going to look for future grants, whether that's through the state legislature, the state budget, federal government, SAMHSA. We'll always try for that, but I'm telling you right now, I'll give you an example: $50,000 to $55,000 each community pays, and we get 2 full-time mental health clinicians responding. That's like a drop in the bucket, quite honestly. So we could use 3 Hillarys. We could, just for our agencies. But
I'm sorry, Chief, but cloning is not a service we provide.
It does go a long way with others when you partner, right, with other agencies, instead of just coming from Auburn Hills asking for this. So that's gone a long way. So we hope in the future that all you can do is speak in positive light of the program. And, we talked earlier, and I'm throwing off the cuff here, but what OCHN is doing by having a centralized hub here of clinicians around the county, whether it be geographically based, of more clinicians, and having a central hub here of supervision and training, and that's really the vision I see that can be very successful, because we meet monthly and we bring in our partners from Troy, Oakland County Sheriff's Office, the other clinicians, and we go around looking at case summaries or partnerships. How can we better improve the program? So I guess more funding for opportunities like that, whether it be the county level or state, because it certainly eliminates tragedies, in my opinion, and gives people the best service.
Thank you. And Hillary, I know you're dealing with follow-ups with a lot of the folks that report a situation. Are we leveraging our customer service, or are you doing all that legwork yourself?
I certainly refer individuals to customer service, or like access referrals, for example, if they fit the criteria for that. A lot of the follow-up I do by myself. I do have some people from the justice team helping me out with kind of the data input piece, which has been extremely helpful. But the follow-up pieces, I'm kind of triaging what comes in, and trying to call, if they're not transported to a hospital or common ground, I'm making sure that they're getting a call. Even if they decline resources, I can't tell you the number of people who are thrilled that someone is calling just to follow up and see how they're doing. So.
Thank you. Yes, Chief.
Last thing that you could help with is, we need Hillary out in the street. We need her co-responding, right? That's the priority. And there's, in my opinion, and rightfully so, it's needed. There's too much data entry. There's too much recording of information. We need it. We need it to support the program and to expand it, but there are, whether it be software technology, there is opportunities where first responders can enter this information. It gets automatically collected and eliminates this redundancy of data entry that, in my opinion, wastes time, where Hillary's needed out in the field. We're averaging in Auburn Hills in an 8-hour period, we're averaging 3 to 4 people in crisis every day, and that's a lot. That's one community. So Hillary can't be everywhere, so that can be very helpful if there's a way to support something like that countywide or through the partnership.
Thank you. Dana, were you going to say anything? Because you're writing notes.
Excited. I
Okay.
want to do more of this, and we've already been working with the county exec and the board of commissioners about additional funding to keep this going. We need more Hillarys, because that's where the real work is in the community.
All right,
So I'm proud.
thank you. Thank you all for coming tonight, sharing your story. It is my favorite part of every meeting, but this one especially, so thank you all 4 of you for coming tonight.
I just had a quick question. Can we come up with like an acronym and call it Hillary? That's just what we can name everybody.
Well, we already have CIT, so.
Okay.
I don't know, HNCR? I don't
Right.
know. Yeah, the core. Thanks, Chief. Okay. Next on our agenda is the board reports. Okay. All right, I do not have a long one. So as we get through the winter, there are a number of activities that are beginning to spin up. We've heard that the emergency order expires on May 11th, unless there's been another change, which means there's going to be lots of process and impact-related questions by persons we serve, their families, and by the people who provide services. So I know there's not a whole lot out there on the state, but hopefully they're going to start publishing some strategy and tactics for us, because we are one of the larger counties and we will have a large number of folks that serve that are going to have questions. From an executive committee perspective, at a recent committee meeting, we finalized the February agendas. We voted to spin up our executive director performance review committee. We actually met again tonight to firm up the template and the schedule. Its role is to make recommendations to the board related to our CEO's performance. That overall process begins today with the goal of having the board determine our CEO's bonus within 30 days of her job anniversary. We also voted to begin the process of selecting an outside counsel, because believe it or not, Dana's been here 2.5 years and her 3-year contract is coming up for renewal. So that process has started. That is independent of the annual performance. From a compliance perspective, board members, please remember to check Boardable and the CBO for any required compliance training, annual recipient rights, or other conflict of interest attestations that may be required. Some items are annual, others are every 24 months. The CMHA Winter Conference has come and gone. The winter theme was Innovation Through Inspiration. I had planned to focus my time on schools, children, youth, and related workshops, given the governor's state focus on children's services. I ended up getting a much closer view at the physical health care side of things. They have a long ways to go to catch up to what we do. I'll leave it at that. And thank you for those of you that kept me in your prayers and thoughts, for those of you that hung out at Bronson to keep me company till my wife made the drive across the state. Board study sessions. Per our discussion at the January board meeting, the January and February board sessions were combined and was scheduled and had happened first week of February. So there is no board study session later this week. We will return to our normal schedule in March. So this is our last meeting for this month for those of you who are keeping track. That concludes my report. Next up on the agenda is the Policy Management Committee meeting. Melchiah, do you have any report?
The policy management met, and we had two presentations. One, the fiscal year 22 recipient rights annual report by Ms. Vicki Suter, and we also had Marquita Massey and Adam Hamilton doing the final report on the QAPIP, which is Quality Assessment Performance Improvement Program. Both of these areas are is necessary for board approval, so they will be coming before the board in today's meeting.
Thank you. Now for the Finance Committee and our Board Treasurer, your report, Dennis.
Thank you. Yes, we likewise had a meeting last Monday, and there's 5 items on our agenda, 5 contractual items. 2 are more of language changes, and the other 3 do have are either extensions, modifications, or renewals of existing contracts. So we'll come up to that next.
Okay, thank you. So now we are coming up to the items that require action. As Melchiah reported earlier from policy, it requires an adoption of the QAPIC report. Is there a motion?
I'll make that motion.
Thank you, Melchiah. Is there a second?
Second.
Thank you, Vijaya. Is there any discussion? Hearing none, I guess we need a roll call vote. So if you would, Sheila, when you have the chance.
Mr. Young? Yes. Mr. Furman?
Yes.
Ms. Naomi Dyer? Mr. Cowan? Yes. Mr. Torres? Dr. Hans?
Yes.
Ms. Newman? Oh. Okay. Ms. Root? Yes. Ms. May?
Yes.
Ms. Woodruff?
Yes.
Mr. Lansman?
Yes.
Motion carries.
Thank you. Next item up comes from the Finance Committee, and there are 4 items to discuss and vote on.
You can go down each one.
So the first item is an update to the PIHP contract. Thank you. Is there a sec? Thank you, John. So there's a motion, a second. Is there any discussion? By the way, for the folks that are watching, we did meet in the various committees. They reported out that during the committee of the whole, these were discussed and then recommended. So if you're not hearing much discussion, that's why. So is there any other discussion on this particular contract? Hearing none, we'll roll call.
Ms. Woodruff?
Yes.
Ms. May? Yes. Ms. Root? Yes. Ms. Newman?
Yes.
Dr. Hans?
Yes.
Mr. Torres? Mr. Cowan? Yes. Mr. Furman?
Yes.
Mr. Young?
Yes.
Mr. Lansman?
Yes.
Motion carries.
That was voted out of committee. So is there a motion to approve this contract? Thank you, Mr. Furman. Thank you, Ms. Newman. Any discussion? Hearing none, a roll call vote, please.
Dr. Hans?
Yes.
Ms. Newman? Yes. Ms. Root? Yes. Ms. May? Yes. Ms. Woodruff?
Yes.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Mr. Cowan? Yes. Mr. Torres? Mr. Landsman?
Yes.
Motion carries.
Okay. Next up is the SIBO contract for our LMS, or our learning management system. Again, that came out of committee with a recommendation. Is there a motion to approve this?
Second.
Okay, so motion by Dennis, second by Adam. Any discussion? Okay. Roll call vote for this contract extension.
Dr. Hans?
Yes.
Ms. Newman? Yes. Ms. Root? Yes. Ms. May? Yes. Ms. Woodruff?
Yes.
Mr. Torres? Mr. Cowan? Yes. Mr. Furman?
Yes.
Mr. Young?
Yes.
Mr. Lammonson?
Yes.
Motion carries.
Okay. Okay, on to the Communications Professional Incorporated contract extension. And this one as well came out of committee, correct, Dennis? All right, so I'm looking for a motion to approve this 4-month extension.
So moved, to extend the contract with communications professionals. They provide our building security, and this is a $40,000 amendment to extend the contract so we can prepare a competitive bid process for our building security.
This is the
which needs to be updated, so.
Right, so we have an RFP that's going to come out during this 4 months.
Yes.
Okay.
So that's my motion.
Thank you. Is there a second?
Second.
Is there any questions, comments, et cetera? Hearing none, roll call vote on this extension.
Mr. Cowan?
Oh, I'm sorry, yes. I was looking at the next.
Mr.
Sorry.
Furman?
Yes.
Mr. Young?
Yes.
Mr. Torres? Dr. Hans?
Yes.
Ms. Newman? Yes. Ms. Root? Yes. Ms. May? Yes. Ms. Woodruff?
Yes.
Mr. Landsman? Motion carries.
There we go. Last but not least is one other contract extension. Mr. Cowan?
Yes, this is our contract with Raymond Robson, who provide pre-audit services, which are very important because of the scrutiny that we're under in the public, all the dollars we spend are public dollars. So this is an extension through the coming year for their pre-audit services, so I'll make that motion for the extension.
Second.
Thank you. So motion by Mr. Cowan, second by, I just forgot your last name, John.
Young.
Young. It's been a long night. Is there any discussion? Hearing none, roll call vote for this motion.
Dr. Hans?
Yes.
Ms. Newman? Yes. Ms. Root? Yes. Ms. May? Yes. Ms. Woodruff?
Yes.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Mr. Cowan?
Yes.
Mr. Landsman?
Yes.
Motion carries.
Thank you. And I apologize for forgetting your name, Mr. Young. All right. Next item on the agenda is our consent agenda. So it's a number of items that require an up or down vote, no discussion, board meeting minutes, meeting minute reports, et cetera. Is there a motion for the consent agenda approval?
I'll make that motion.
Thank you, Malkaya. Is there a second?
Second.
Thank you, Vijaya. So it's moved and seconded, no discussion, just a roll call vote to approve the consent agenda.
Mm-hmm. Mr. Furman?
Yes.
Ms. Root? Ms. Newman?
Yes.
Mr. Cowan? Yes. Mr. Young?
Yes.
Ms. Woodruff?
Yes.
Dr. Hans?
Yes.
Miss May? Mr. Landsman?
Yes,
Motion carries.
thank you. Okay, other business. Do we have other business this evening?
There's nothing listed. I'm not sure if you want to bring up the PAC, conversation regarding the new post that, was shared by Macomb County. I shared it on Boardable.
Would you like to present that? Because I have not had a chance to look at it.
So in Boardable, there is a discussion post shared by, Macomb County board member. I'm not sure if everybody had a chance to look at that, but if you get a chance to look at it, it's that time of the year again where, donations from board members to the PAC. If you need navigation on where to send it, or I think Patrick's still taking checks. If not, I think there's an online system like last year too. So just let me know if you need an assistance with that.
Thank you.
Mhm.
So I didn't realize that you had posted that notice already, so I missed that.
Yeah,
Okay. I have already, while I was at the conference, I made my PAC donation, so they are not tax-free. So be aware of that. I can't write them off, but it goes to a good cause, and right now the association needs to rebuild their war chest. It's not much of a war chest, but they still need to rebuild it after this last election. So I'm hoping that we can get 100% board participation in making the donations to the PAC. Yes, Kaya. Ms. Newman.
In the past, what the board has done is give one stipend amount towards the PAC, or the best that you can, just in case somebody's not knowing what to give.
Thank you, yes. And I gave double that this year, just so you know. And you can call them and they'll verify that. It's for a good cause. It is for a good cause. All right. Any other business? For other business. Moving on then to committee reports. We'll start with recipient rights. Dr. Hans.
The recipient rights advisory committee met on February 2nd at 4 p.m. The meeting was called to order by Ms. Ristish. Ms. Suder made presentations on OCHN annual plan. It was reviewed and discussed, and she also presented on the recipient rights advisory committee report, annual report, which was presented to the board last week. Mr. Aaron Winston, the rights specialist, talked about the processing of right complaints and the timeliness of assessing these complaints. This was followed by discussion on RRIC policies and member responsibilities. As far as the site reviews, 17% of the sites have been reviewed by January 3rd. It is expected that the partial hospitalization and inpatient reviews will start in the spring. Christine Burke spoke to the committee for their input for the draft of the needs assessment document, which is in process. And lastly, there is a vacancy on the committee, and if anybody is interested, you can spread the word. The interviews will be held on March 2nd meeting. Thank you.
Okay, and if someone has a question about how to apply, they just see Vicki?
Yeah, Ms. Suder can
Okay,
help them.
thank you.
Thank you.
The next would be the Citizens Advisory Committee. Rena is not here tonight, but she did file a report. I'll read it. The CIC met on Wednesday, February 15th at 9:30 a.m. After roll call and public comment opportunities, we received communications report from Christina Burke. We were provided with a presentation by Bridget Heffron from the MDHHS regarding Medicaid spend downs. Her presentation reviewed what spend downs are, how the amounts of spend downs are determined, and what offices manage the spend downs and must do to verify the spend downs. We were provided with credentialing update from Charlotte Rowe, OCHN's provider network analyst. She indicated that Pine Rest is being contracted with OCHN as an inpatient hospital. Good. This was because Common Ground was sending packets to Pine Rest, but since they weren't contracted with OCHN, they were not looking at the information sent by Common Ground. OCHN would like to add them as another option for inpatient hospital services as an additional option. Additionally, the Judson Center, a current provider of other services such as ABA and vocational services, is in the process of being added as a provider for SED, or severe emotional disturbances services. The next meeting will be held on March 15th at 9:30 a.m. Thank you. Regards, Rena. And then last but not least is the Oversight Policy Board, Sarah May.
The SUD meeting was originally scheduled for Wednesday, January 25th, but due to road conditions, it was the really bad day. We rescheduled it for February 1st at 1 p.m., and we met here. We were introduced to the new SUD director, Megan Phillips, who has an extensive personal, educational, and professional background in SUD services and supports. Project 10100, TEN, and then the numbers 100, provided a presentation on therapeutics controlled substance management. Their machine, which is a CMS machine, so Dwayne gave a high-level presentation on the science and methodology behind the creation of the device that safely allows individuals being served in the MAP program to take home their daily medications for up to 13 days at a time instead of having to go to the clinic on a daily basis to receive their treatment. I took extensive notes and have a hard copy of their presentation. I would also suggest that any board members interested watch that part of our meeting and possibly have them come provide that presentation here. I think that we'd all, first of all, it's kind of cool, but there's some questions that I think that need to be asked about it. The SUD is working on their needs assessment, RFP, which is due in September to be released at the close of the fiscal year. Andoe provided an update on upcoming community outreach events. Meridian and OCHN are to have a workshop on naloxone education and harm reduction on Wednesday, April 12th, and then the community baby shower will be held from 10 to 1 on June 18th. Christine Burke provided a fantastic packet of with a list of the legislators and districts that fall within in Oakland County, along with their bios and contact information. It's a neat list to have so that we can reach out and advocate. And then finally, there's an open board position that had no applicants as of our meeting on February 1st, and anyone interested can find the application on OCHN.org.
Thank you very much for your report. This is, as we get close to wrapping up our meeting, this is the second opportunity for public comment. Either if you're remote or if you're in person here, you have 5 minutes for making comment. Is there anyone remote tonight?
There's no comment.
All right, thank you. Is there anyone in the audience tonight that would like to make additional or make public comment? Hearing none, we'll move on to our director's report. Dana, you have the floor.
Good evening again. I first want to start by really being thankful for Trish and Hillary and the great work that they're doing. And the whole justice team is really actively involved in really serving the community. I also have to also acknowledge, Dr. Pozios and his direction. We're exploring a lot of options as it relates to justice initiatives, and the team has really come together well to really be responsive to the needs in the community. So it's something that we should all be very, very proud of, and we're continuing to look for funding so we can expand those services. And even on a national level, Dr. Pozios is working with the American Psychiatric Association Foundation to also bring additional programs and funding to our organization so that we continue to expand on what we're doing and not just stop when the funding ends, but look for funding now so we can continue without any gaps. So that's something we're actively working on. The other thing I wanted to talk about was Black History Month, of course, and I was looking for something that really spoke to Black history and also to mental health history in terms of we know that African Americans have a slower rate of engaging in mental health services and behavioral health services. And the way that we look at that even now is looking at those communities of need and really going to those communities and providing education. Many times they won't seek out help unless you go and be a part of the community. So this year, that's a big part of the push for our team is really to get out to those communities and make ourselves available to do screening in the communities where people are that need our services and supports. So I think our community education goes a long way, but we need to have more physical presence in those areas to make sure that the people who need us really know how to reach us and where to go to get those services and supports. And that's also a theme that I saw at the conference I went to, the National, don't get me to remember all the names and acronyms, but it's a National Council of Community Mental Health in counties working together. And during this conference, they talked about being in the community and making sure that there is access in a variety of different ways. They address the workforce. They address a number of different things that we need to do as an organization to really access additional funding as well. So that was a really good conference. I actually had never heard of it before, but it was worthwhile, and I'll put my notes together so you all can see that. The other thing I wanted to talk about has to do with our DEI efforts here. I know Mr. Hooper is scheduled to do a board study session, but I really want you to know that we're working on this every day and making it a part of our culture and really practicing what you hear a lot of. We had a exercise last year that had courageous conversations, and it was really an eye-opening experience and program that we got people to open up in smaller groups and talk about some of the barriers or challenges that we all face being in a diverse work environment and making sure we're being inclusive and not exclusive, and then looking at diversity in a number of different ways. And it's interesting, we're going to do it again, and we have the same or maybe more people interested in following through on this program. So we're excited to start that. The other thing I'll say is we all have to step back and see we had another tragedy at Michigan State University. So as an alumni, it really hit home for me, but also while I was in DC, I was really proud to see my team immediately picked up and started to plan an extensive response plan. So that, you know, you have a good team when you're away, and they initiate this on their own and really came up with some great details, reaching out to a number of people in that community, the CMH in that community. We made phone calls to see if there was a way that we could assist in any way. To the fact that Bob Sheehan, who was in Washington with me, actually gave us a shout out in that meeting to let people know that we had already reached out to help and support. So that's something we're going to continue to do. Right now, we're not getting a lot of requests, but we also did some things internally with our staff who have students at the school. So the other thing I'll talk about in terms of following through on some of the goals and objectives we have is our team has had this CISM training. So Trish will help me with acronyms, Critical Incident Stress Management Training. So what it does is it works with people after they experience a trauma or are related to somebody who's experienced a trauma. So we actually had 2 groups of people that met. Dr. Pozios led one group, and I think it had 70 participants in it. And then I don't know who led the other group. Was it you, Trish? How many people did you have in yours, Trish? Oh, she's eating. Oh, Okay, thank you for training me on that. So the other things I'll talk about just really briefly, my report is with a lot of the detail and the data, and so we're constantly looking at ways to improve how we collect data and analyze the data to make decisions, right? So one of our first efforts is really looking at the access piece and how we welcome and enroll people into services. And so Nasser and his team are really actively involved with the group in access and going through their process with them, looking at how they collect data, looking for ways to become more efficient and actually get the information in our system so that even if we don't end up enrolling someone, we have a record of the number of lives that we actually touch. So that's a big piece of really making that better, getting staff trained. Kim is always over there really supporting that team. So we have some opportunity for improvement. And I think you'll see that we probably do a lot more than what we're even reporting. So the hope is to really clean that process up and make it better for the people who are providing the service, but more importantly, the people who seek our services. Did a presentation at the Board of Commissioners, and so I actually really liked the report and how we laid it out for the quarter because it highlights our work with the homelessness. I know there's another word for it, and I can't remember, unhoused or home, I think it is. But we're really working closely with Community Housing Network and looking at those social determinants of health early on when we screen so we can address those things in the treatment planning. We're working with Senator Rosemary Bayer, who was able to get funding, so we do violence reduction. Transportation, we're working with SMART. We have a meeting with them, I think, tomorrow or Thursday, and also working with the Board of Commissioners to see how we can get involved to improve transportation for the people we serve. And we know this has been, I think this was an issue even before I started, and so we finally, I think, are really seeing some movement and looking at it as a service line and how we assess for transportation needs. And the state has already said we need to separate that out as a billing process, so we really will be able to really see the needs of people and address those needs through that work. And then finally, we're always working on anti-stigma campaigns, and again, Senator Bayer and MDHHS is funding us to do more anti-stigma programs, get more information out to the community. And I'll let you review this for yourself, and you can ask questions because we already had a great presentation on co-responders and CIT. But the other thing I wanted to emphasize and acknowledge Kim and her team's hard work in clinical is we've opened the crisis care unit for our youth and family care connection, that crisis service, stabilization service, even though we're not really supposed to call it a crisis stabilization unit yet, opened officially on February 13th. So we had already opened the assessment part or the access piece. Now we're opening up the 8-bed unit. So that'll be very helpful in diverting people from the ED. So with that, I will stop and see if there are any questions. No?
On the separating out the transportation piece, it sounds logical and reasonable. Are there any concerns with that, or is that, I mean, is that more money going to come, or is that?
I think you will be able to see through a screening and assessment process what the real transportation needs are and what's the best way to meet those needs. I think right now we sort of put it all together, and we don't look at individual ways that people need transportation. And if we do, it's not pulled out where you can actually see it in a code. So looking at ways to actually see what the need is and what's the best way to address that need.
And hopefully easier on billing then.
Definitely billing, but I think the other piece of it is making sure it's a part of the individualized plan of service. So you can really see it as part of the treatment. Because if you can't get to the place you need to be, how do you get the service you need?
Okay. Thanks.
You're welcome.
Under the violence reduction, what does that entail?
That entails, first of all, they're doing like an environmental scan and research and looking at where the issues and problems exist. Actually, the team just presented a report or a draft. I think it's the final report. They've been working on this for about a year. through this funding, and just setting it up. They have a consultant that works with them, and setting up the different activities involved in determining where violence is occurring, and then also developing programs and just initiatives to stop and reduce violence in communities.
Okay.
Any other questions or comments for our executive director? Okay. Yeah, please, Malkia.
What does the anti-stigma, program entail?
So, I'm going to read from my notes, so I get it all in there. Using grant funding initiated by Senator Bayer and Michigan Department of Health and Human Service, COVID Substance Use and Gambling Services, long title, OCHN is planning extensive and comprehensive awareness campaigns to address the violence reduction, suicide, stigma, and loss of life from opiate overdose. So it's just another way to put out local campaigns like television, billboards, news ads, the web, print media-based primarily. Yeah. We'll consult with you.
We're still going to have our best, and we'll still have our team that does it, that Malkia and others are on.
Yeah.
We're doing great.
For sure.
It's not going away.
No.
Good.
We need everything we can have to educate the community.
Okay. And we need to, often. Okay. Board member comments. I'll start at your end, Adam.
I know a lot of people have already commented on it tonight, but just to put a bow on it, just a really inspiring presentation tonight by the co-responders, and it's just a reminder of what we can do when we emphasize the team approach for not only the people that we serve, but the community at large as well. So again, a really uplifting, great presentation tonight by the Stories That Inspire. Thank you.
Christina.
I don't have any comments. Thank you. Have a good night.
Malkia.
No comments, thank you.
Dennis.
I had to be at the Oakland County Board of Commissioners last Thursday on a work matter, and I got to see Dana's presentation, and it was very well received, and she went around and met some of the commissioners, which is part of your job, so that's good, and I think she has great respect of the county commission, and that's very important, our relationship with the county commission. Second, there was a bonus because one of the items on the agenda, my item had been an add-on, so I had to stay till the bitter end. But I want to congratulate Jonathan and Christina, who were reappointed for 2 well-deserved terms by the board. And just one observation this evening with the presentation. With all the short stories that they shared and the board shared, it's pretty obvious that if this program wasn't in place, how many people wouldn't have been reached, or how many people would have been treated differently, and maybe not the positive treatment that they got because of the training and the understanding. And to have 2 groups, law enforcement and mental health, come together who normally aren't brought together, and serve the public in this manner is really wonderful. It doesn't happen all the time, and I think it's kudos to everybody involved. And I'm so glad we endorsed this program and got it going. Thank you.
John?
Couple things. The committee of the whole in March, are we the 13th or the 14th? I've got one calendar that says Monday and one that says Tuesday. Okay, all right, so change the website. Okay, also following up on Dennis, I watched you on TV, Dana. You did a great job, and the media coverage afterwards was great. I mean, front page is always a good thing. Also, and then I just got the county press release, one of your staff is on the 40 under 40. So, Kara? Oh, congratulations.
Sure.
Kimberly Flowers is being recognized recognized as a Women of Excellence from the Michigan Chronicle, so.
And the 40/40 is on Cranes? 'Cause mine, oh, the county one? Okay, 'cause my Cranes came today and I haven't had a chance to read it. Okay. Yvette?
It was great to hear the stories that inspire, especially when the chief talked about they're now being proactive rather than reactive. Because I was married to a law enforcement officer, and we were always on the opposite ends of the podium, me with my counseling background and him and his law enforcement. And to see that is now a partnership, mental health and law enforcement is great, and I know that great things will come out of those partnerships as they continue to grow.
Vijaya?
Yes, just expanding on Yvette's comment, I think it is very important for the first responders and also in the medical field, the ER nurses, they, the incidence of burnout where now hospitals are looking for full-time nurses and they can't find any. It's very, very difficult for them. And also for the ER physicians, I think there is still a little bit of stigma in the physician community for seeking mental health support. And I think that is also something that needs to be addressed. In fact, during COVID, the suicide rate among the ER physicians has gone up.
Sarah?
No comment, thank you.
I want to thank everyone that came tonight, those that presented. It was interesting to hear a different aspect of what they were talking about tonight was not CIT, but it was co-responders. So yet one more aspect of our integration into the community and the effectiveness or the efficacy of that. So I just think it's really wonderful. The second I'm going to add to the comment that Vijaya, you'd made about the hospitals. Having recently saw it, I saw an interesting sign at Providence Park, where they actually have a sign where they have expectations of the people in the waiting room, and whether that's patients or families, to not get into fights and not physically threaten healthcare workers. Otherwise, they would be removed. I've never seen a sign like that, but I thought it was interesting that that's the level that things have gotten to in terms of, I hate to put a term like antisocial behavior, but I've never seen a sign like that. I was really surprised. And I don't even know how I can respond to my own comment other than that I was surprised, and leave it at that. And that's all I wanted to say tonight. Thank you everyone again for coming. If there's nothing else, we've hit the end of our agenda, so I'm going to take us into adjournment till our next meeting.